to the channel, The Pregnancy Coach. What are we going to talk about today? We are going to discuss fetal positioning. Why is fetal position so important? Because fetal position helps determine whether you're going to have a vaginal delivery or a surgical delivery. It's one of the very important criteria when the doctor is trying to decide what kind of delivery you are going to have. The second thing that fetal positioning can help you achieve is a shorter labor and a less painful labor. Isn't that amazing? So I'm going to talk to you a little bit about the different fetal positions that can help in terms of what type of delivery you will have. And then in subsequent videos, we will also be showing you how to influence the position of the baby in the womb. So keep watching. So here, what I have is a normal size female pelvis. And this is a normal size full-term human baby doll. Right? Babies can take a variety of positions. The most favorable, obviously, is the head down position. Now, what happens in this situation? When the baby is in the head down position, the head is delivered and then the baby can now easily breathe on his or her own because the nose is already outside. After this, the rest of the body is fairly small and can simply slip out. Sometimes the baby may take a breech presentation, which means the baby is sitting like this in the womb. So if the baby is sitting like this, that means the baby is in a breech presentation, which means presenting buttocks first. Now here in this case, the legs of the buttocks will get delivered first. The umbilical cord will follow. The shoulders are broad. The head is big. This can get stuck and it can result in a problem and we may even lose the baby. Therefore, the doctor will recommend a surgical birth if your baby is in the breech presentation. Sometimes babies can also do what we call a transverse lie, which means they are curled up like this in the womb. They really have no space, but they've managed to lie down horizontal. It's very difficult for this baby to change position in the end because the baby is so big that there is no space to somersault, etc. Sometimes the baby may even be in an asymptotic position, which means the baby is kind of at a transverse type of a lie like this, where the baby is stuck against a pelvis bone. One last position that a baby can take in the womb is what we call the brow presentation. So when your baby has taken a brow presentation, this is what the baby has done. The baby is head down, which is great, but the baby is also positioned like this. That means the baby is facing the world. And when this baby tries to come through with the uterine contractions, there is a lot of pressure and this is very uncomfortable for the baby. This baby is going to not move down, is not going to descend, and labor will obviously be longer, eventually resulting in a surgical birth. So overall, the most favorable position is head down. Now, even in a head down position, we are always considering the baby to be like this. This is called an anterior baby. The baby is facing towards the mother's back. The baby's back is against the mother's abdomen. A baby who is positioned like this, where the baby is facing the world and the back of the baby is against the mother's back, is called a posterior baby. For this baby to come out once labor starts means the baby has to do a complete rotation and then start the descent. To show it to you on this video is just a few seconds. But for the baby to actually do this can be a lot of hours. Also, this is rubbing against the mother's back and it's causing you a lot of back pain and a lot of discomfort during labor. Therefore, we consider a baby who is anterior and in the head down position to be the most favorable position for labor and birth. I'm sure you learned a lot by just watching this video, and you will now be able to understand your sonographies, your reports, and those doctors' words much better. In our subsequent videos, we are going to show you how to actually turn a baby into a favorable position. So keep watching, subscribe to the channel, and make sure you share and like with all your loved ones. Have a great day.